I was 24 when I had my son, and so I didn't know much about children's health. The doctor told me that he had Down syndrome. And they gave me this horrible list of all of the things that might happen to him. This nurse, she said to me, there are a lot of programs that are out there to help him. And specifically, she named early intervention.
When Roderick was born, he came 3 months early, weighing 1 pound and 9 ounces. He's going to have lots and lots of medical challenges. Bleeds on the brain, he may have cerebral palsy, he may have vision issues. They sent us to early intervention. So he had a physical therapist, he had an occupational therapist, he had a teacher.
Because of the nature of my birth, early intervention was a necessity. You have this window of from birth to 3. The sooner you get a hold of early intervention, the quicker that you'll be able to get the assistance that you need for your child.
Jordan attended school here, right where I was working. He was jumping onto other children. He was bumping into a lot of furniture, and they said to me, you can try early intervention. My husband, his reaction was, there's nothing wrong with him, he's a baby. But I said, you know what, I'm gonna do it anyway. His speech therapy was done in school, and so they would see him once in class and once in the clinic. Occupational therapy was done at home. I'm so thankful that the therapist really worked with me and not just worked with him.
There's several barriers that prevent parents from utilizing the early intervention program.
One of them is really about stigma. They believe that my child has a disability and people are going to look at my child differently.
A lack of knowledge, fear, and distrust. A lot of people don't trust the system, but we can let the people know that this system works because we experienced it.
To fathers who are worried about making this step, your child may suffer as a result of your pride. You want to make the best decision possible, and if that means humbling yourself so that your child can get the care that they need, do that.
The early intervention program itself cared about my family. I didn't have to have all the answers. The therapists from the early intervention program were there to help me teach him. The program gave us a sense of normalcy. And so early intervention also gave us hope for the future.
He gets to first grade, and they're like, why isn't Jordan in the gifted and talented program? And I looked at them and I'm like, gifted and talented? Even though my son gets services, that doesn't mean he's not smart. That doesn't mean that he can't excel. And sometimes as parents, we think that if a child has a disability, that they're less, and it's not true. They can soar, they can achieve. And I see that with my own son.
Programs of this nature empower families, so don't hesitate. Pick up the phone, call 311, ask about early intervention.